Good afternoon, Miss. I am Arsanvine M. Caban from BSN2 Weidenbach, and today I am going to perform nasal instillation. So what is nasal instillation? Nasal instillations are used to treat allergies, sinus infections, and nasal congestion. The nose is normally not a sterile cavity, but because of its connection with the sinuses, medical asepsis should be observed carefully when using nasal instillations.
Objectives: to instill directly the medication into the nostril or nares, to provide means for nasal evaluation, to obtain desired therapeutic effect.
Gather equipment, check the medication order against the original physician's order according to agency policies. Clarify any inconsistencies. Check patient's chart for any allergies. This comparison helps to identify errors that may have occurred when the orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of a medication to be administered. Consider the appropriateness of a medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to patient's disorder, and this can also be used to educate the patient about the medication. Perform hand hygiene to prevent the spread of microorganisms. Place medication on a tray or move the medication cart outside the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport patient's medication to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevents accidental or deliberate disarrangement of medications. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures that the right patient receives the medication and helps to prevent errors. Good afternoon, sir. Ako listeners. Fine. Pwede ko man tayo mga identification band? Pwede mo state mo name? Anthony Tigihan. Okay. Thank you, sir. 7. Explain procedure to the client to gain cooperation and to allay anxiety. Good afternoon, what, sir? Bale, ma-perform kasi mo subong sir nasal installation. Bale, nasal installation, amo na siyang pagpatulo sa bulong sa imong ilong. Bale, magkambag ko karon sir nga maginawa kasi imong baba, maginawa kasi imong baba, sir ha? Okay, sir. Thank you, Gid. Offer tissue to patient and ask patient to blow his or her nose. Blowing the nose clears the nasal mucosa prior to medication administration. Good afternoon, sir. Sir, mahatag ko si mo tissue, sir. Masikma to, sir. Kuada na mo mas, sir. Sige, sir, ha. Sikma, sir. Sige, sir. Thank you, sir. Have patient sit up with head tilted well back. If patient is lying down, tilt head back over a pillow. These positions allow the solution to flow well back into the nares. Do not tilt head if patient has a cervical spine injury. Draw sufficient solution into dropper for both nares. Do not return excess solution to a stock bottle. Returning solution to a stock bottle increases the risk for contamination of the stock bottle. Ask the patient to breathe through the mouth. Hold tip of nose up and place dropper just above nares, about 1/3 of an inch. Instill number of drops in one nares and then into the other. Protect dropper with a piece of soft tubing if patient is an infant or young child. Avoid touching nostril with dropper. Breathing through the mouth helps prevent aspiration of solution. The soft tubing will protect the patient's nares from injury during administration of medication. Touching the nares may cause the patient to sneeze and will contaminate the dropper. Have patient remain in position with head tilted back for a few minutes. Tilting the head back prevents the escape of the medication. Sir, good afternoon. Sir, maginawa ta sa baba, sir, ha? Okay, sir. Sir, matangga ta, sir. Sige. Inamat patulog na ako, sir, ha? Sa piyak naman. Okay, sir. Thank you. Bale, stay ka lang sa muna nga position, sir. Mahambalang ko kung mag-move ka na sa original position mo, sir, ha? Okay, thank you. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Assist the patient to a comfortable position. This ensures patient comfort. Evaluate patient's response to the procedure and medication. The patient needs to be evaluated for any adverse effects from the medication or procedure. Sir, good afternoon. Pwede ka nakabalik sa iyong original position, sir. Bale, sir, wala man nga katol or kasakit, sir?
Wala.
Sige, noted, sir. Thank you, Gid.
Evaluation. Patient cooperates with nasal instillation of medication. Desired therapeutic effect is obtained. Experiences no adverse effects, including allergy response, systemic effect, or injury.